welcome to Up Your Assets podcast. We are here providing information on various financial topics, and today it's all about healthcare and health insurance, to be more specific. And with us today, I'm delighted to introduce you to Christine Simone, who is the CEO and founder of Caribou. And Caribou is a product that we discovered about 9-10 months ago that provides and assists us in helping our clients with health insurance. And that's particularly true as they're entering into retirement or in retirement and deal with Medicare and Medicare Advantage, as well as those that may be buying in the marketplace. So welcome, Christine. It's nice to have you on Up Your Assets.
Yeah, I'm so happy to be here. Thanks so much for having me, Ray. And it's been a pleasure working with you guys so far.
Well, that's great. Thanks. So, Christine, why don't you tell our audience a little bit about Caribou, how you started it, why you started it, and tell us a little bit about the background of how the program is put together.
As you might imagine, I have a background in the healthcare field. I actually went to school wanting to be a doctor, but ended up taking a slight pivot towards more of the technology, startup, innovation side of the industry. And what I really quickly learned working with a few companies right out of school was that the incentive structure in the health insurance arena was very biased. There's a really big gap on education amongst the general consumer. And I really wanted to build something that helps people become better educated about their health insurance decisions. And that in turn impacts financial stability and clarity later on, once you know what you have covered, what your insurance is going to cost you, making decisions based off of your priorities instead of other people's priorities, maybe based off an incentive or a bias. And so that was really the genesis of wanting to create the company. Slowly but surely really uncovered a gap specifically within financial services, where we saw that an advisor, a financial planner, wealth manager, they really had no tools at their disposal to help their clients make these decisions, even though they were helping their clients make other financial decisions related to their estate, their taxes, their portfolio. You know, healthcare is one of the things that clients will spend one of the most money on in their retirement. And so seeing that gap within wealth management specifically is why we chose to focus on advisors exclusively with the business and build this software for them to distribute to their clients.
Oh, well, it's quite a story. Interestingly, I went to college and thought I was headed to med school, much like yourself. In fact, my dirty little secret, when you play that parlor game of what is the secret that nobody knows about you? I have two of them. Well, one of them is, what was my major in college? And the answer is?
Probably biology.
Zoology.
Zoology. Wow.
Yeah, which I immediately put to work selling computers for IBM. And 18 months later, I got into the financial business, which I've been doing now for 53 years. So interesting that we took that same divergent path.
Well, if there's any young people listening to the podcast, what that tells you is that you can take pivots in your careers based off of things you did or didn't study in school.
Absolutely the case. So tell us a little bit about where we happen to be recording this in late October of 2024. Open enrollment for Medicare is starting very shortly. That's an important time period. So talk a little bit about the important things about that open enrollment process, if you will.
Yeah, so specifically for Medicare, open enrollment started October 15th. So we are into the open enrollment season right now. This is the time of year where you can change your Medicare configuration. Now, if we want to get into the weeds just a little bit, one of the biggest things that people change is their Medicare Part D drug plan during this time. It's one of the things that you can change every year, no questions asked. But that's if you're on what's called original or traditional Medicare, meaning you have Part A, Part B, a supplement, and then a Part D prescription drug plan. If you're enrolled in Medicare Advantage, you can also change your entire Medicare Advantage plan. Your drug coverage is embedded within that Medicare Advantage plan, so you're also changing your drug coverage as a result of that. But what becomes challenging to do is switch between Advantage and Original Medicare, specifically if you're on an Advantage plan, going back to Original Medicare or Medicare Original for the first time is challenging, because if you don't enroll in Original Medicare when you are first eligible, you are subject potentially to medical underwriting to get a Medigap policy. And that is very significant because that Medigap policy is going to cover the 20% that Medicare Part A and B don't cover. So you don't want to be denied for that Medigap policy, because if you were and you still chose to enroll in Original Medicare, then you would be infinitely exposed to 20% of your healthcare costs moving forward, which doesn't have a cap. So that is a really important decision to get right at the onset, meaning when you first turn 65, or if you retire past the age of 65 and you're first enrolling in Medicare, understanding the differences between Original Medicare and Medicare Advantage is really important, because during open enrollment, you can't change everything.
Well, this is really an important point, and thanks for bringing it up early in our podcast. But let me kind of give some examples, and let's direct our listeners. So I turned 65. I'm automatically going to qualify for Medicare Part A, and if I'm still working, I can delay getting Part B and Part D if I want to. And we ought to say Part A is all about the hospital. Part B is about the doctors and the diagnostics. And Part D is about the drugs, as you mentioned.
Mm-hmm.
So I can delay if I'm still working, if I want to stay under my group plan for getting Part B and Part D. But I sure want to be sure that I don't have any gaps in my coverage. So I got to plan carefully as I start to enter into retirement. So I join Medicare, okay? And then for whatever reason, I decide I'm going to switch to Medicare Advantage. No problem, right?
Mm-hmm.
And now a couple of years go by, and for whatever reason, maybe my doctor isn't in the network with the Medicare Advantage, perhaps. So, and I want to switch back to Medicare. Now, if I understood you correctly, I can switch back to the Medicare portion, the Part A, B, and D, without any issues. But can I, having had Medicare in the beginning, am I still covered without a physical for the Medigap policy, or do I have to get potentially medical underwriting?
You would have to go through medical underwriting if you wanted to get that Medigap policy. And so that is especially important later on, because you mentioned, for example, when your doctor's isn't covered, maybe this is a specialty doctor, maybe you're dealing with a chronic condition because you're in your 70s, and that's very common. And so switching back to Original Medicare with the Medigap policy, they're going to look at all of those things. What I'm trying to say is that one of the reasons you would want to switch is because you're managing a chronic condition, which is exactly why they want to make it hard for you to do that by putting you through medical underwriting. And so people need to think long-term about their planning for Medicare. One of the key differences between these two options is that Original Medicare, you can basically go to any doctor in the United States. You have access to pretty much, I think it's like 98% of facilities and doctors and hospitals. In some cases, though, you need to have already been a patient of theirs before you were enrolled in Medicare, but you do have a lot more flexibility than on Medicare Advantage, where you're tied to specific networks. So your comment around wanting to see a specific doctor was absolutely right. That is one of the big reasons that people switch, or they want a lower cap on their drug or on medical and drug expenses. Well, actually just really exclusively medical, because Medicare Advantage plans have much larger out-of-pocket costs typically than Original Medicare would.
A really important point. I mean, 50%, latest statistic that I've read, are taking Medicare Advantage plans. Mm-hmm. And I suspect that not very many of them are having it disclosed to them that if they ever wanted to switch back to Medicare, that they may find themselves in a situation where it just won't be financially feasible, no matter how badly they want to do it. So thanks for that very important explanation.
Well, one important thing to add on to that too. Well, two important, actually three important things to add on.
Okay.
If I can. So on Medicare.gov, you can't search for which doctors are in and out of network of Medicare Advantage plans. So that is a huge blind spot on the Medicare website, which is why our work with you is really important. You would have to call all your doctors to figure out whether or not they accept a Medicare Advantage plan if you were looking to evaluate those options. And so that's where we have access to that data. We provide you and your clients with that type of information. And so that does take it a level further than what is available on Medicare.gov, which is why it's important to engage an advisor in this process. They have access to this sort of information if they're working with a company like us. Second is that in some cases, I don't want to make blanket assumptions. There's some states, for example, that have guaranteed issue rights. New York, Connecticut, Maine, I think Massachusetts as well. In those states, you don't have to go through medical underwriting. You just might be subject to a waiting period. So if you're a lucky person and live in one of those states, this actually might not apply to you. You can switch back and forth more freely, but that would mean you have to keep track of those laws and legislations and make sure that there's no changes being made in the future and you don't miss an opportunity to switch back if you want to be on Medicare Advantage for some reason now. And then the last thing, I promise, is just that you mentioned automatically enrolling in Part A as well. One of the reasons why people might delay Part A is to keep an HSA and contribute to an HSA while they're still working past the age of 65. So it's not necessarily always a good idea to automatically enroll in Part A if you're still working. If you're on a high deductible plan and have enjoyed contributing to that high deductible plan, you can continue to do so, but you have to delay Part A as well as B and everything else.
That's a great point, and that's why we've enjoyed working with you all this time, because you've always got those little nuggets that are those pearls of wisdom that help us and more importantly help our clients.
Yeah, of course.
So, what kind of changes can we expect in 2025 to Medicare and to the marketplace?
Yeah, so everything we've been talking up until this point has been Medicare related. We also work with clients under the age of 65, and let me just briefly touch on that open enrollment period too, and then the changes coming up for both. Right. So with Marketplace, open enrollment starts November 1st, and in most states it runs until January 15th. About 50% of states run their own marketplaces. They don't use healthcare.gov, the federal system. They just have their own websites. But all of the plans are still Affordable Care Act compliant, cover the 10 essential health benefits, all the same ways that they would if you were to enroll on healthcare.gov. They just choose to run their own websites, basically. So those individual states that are running their own websites, they might have different dates. It might end in December. It might extend into February. So if you want to enroll in a marketplace plan or change your existing marketplace plan, our recommendation is always just get it done by December 15th. That way your plan becomes effective January 1st and you don't have to worry about missing any deadlines. There's really only two changes coming up this year. It's that Arkansas and Georgia are running their own marketplaces. So if you live in one of those states and you've historically been enrolling through healthcare.gov, you will be redirected to a new website. Otherwise, everything is the same, other than probably just a slight increase in prices. We see that every year. We don't yet have access to the plan data as of the time of this recording because we're still almost just over a week out from November 1st. Yeah. But that's really the only thing that we anticipate changing. The other thing that you would want to just look out for is if you've been lucky enough to live in a state with PPOs on the marketplace, which not every state has, maybe just look and see whether or not that is still the case for next year, because those network restrictions on EPOs or HMOs can add some of those same constraints that we were talking about when it comes to Medicare Advantage versus original Medicare.
Any particular reason a state wants to have their own plan versus letting the federal government do it? I mean, any advantage to the people living in those states? Are the plans significantly better / worse?
No. So the management of those plans are all the same. They're still provided by the government. There's still Affordable Care Act, like approved plans. And so that is all the same. I really don't try to understand why the government does things that they do. But
you and me both.
Yeah. It's really just the website is different. Some of them do have restrictions, like you can't search up to more than 5 doctors at a time or more than 5 medications at a time, which does add some frustration to people who live in those states. Really, healthcare.gov is a pretty good website for a government website, so it's a shame that all don't use it. but I'm not entirely sure why. That's not the case though with Medicare. Everything is done on Medicare.gov, which does simplify things. And one of the really big changes that we're looking at going into 2025 is the cap on drug costs. What's really important, this is part of the Inflation Reduction Act, and there will continue to be some changes to Medicare in the future, specifically the way that they negotiate drug prices. Hopefully that will bring prices down. But what's really important for 2025 is that this $2,000 drug cap only applies to covered prescription drugs. So if you are taking brand name drugs, most of which Medicare does not cover, some really common ones lately would be like Ozempic or Wegovy, these weight loss inhibitor drugs that a lot of people are taking that Medicare does not cover. This drug cap does not apply. So it's not as simple as thinking no matter what medication I take, I will only pay $2,000 out of pocket this year. You could still have costs that exceed that amount if you're taking medications not covered by Medicare.
So, that's amazing, Christine, to think that something like Ozempic, which can help significantly reduce the weight of individuals, which study after study after study says way less, less opportunity for diabetes, better for your heart, better for your lungs, your overall physical condition. And then the government doesn't pay for it. That's amazing.
Yeah, I mean, technically, this is the way that drug coverage has worked when it comes to, you've got like that brand name drug. They've got a patent until there's a generic out, really. That's when consumers see, more favorable drug pricing. It is a shame that these aren't more widely available, but I guess technically they're in their infancy. So, and this is where the pharmaceutical companies make all their money back for everything they put into discovering these medications.
We're not opposed as an investor. We're not opposed to people making money, just not too much money.
Yeah, that's the problem. They're definitely making too much money, which is why a lot of us were afraid with this drug cap that would cause Part D premiums to skyrocket, drugs to drop off formularies that were previously covered, because now you're limiting the profits to the insurance companies, right? Thankfully, we've not seen that. Now that the plans are released, we've done kind of our quick look into things. It seems like things are fairly steady, which is a really good thing to see.
Good. Well, let's take a moment and tell our listeners what the report that Caribou produces, what it looks like and what it's for. And I should say right now to all of our listeners, first of all, I have no personal interest in Caribou. I have no, in any affiliated way, have any interest in Caribou. You are not paying me to be on our podcast. It's just a great service that we have found to be extremely valuable to clients and to prospects as we're doing their financial plan. So take just a moment and talk about at a high level, what does that report look like and what does it entail?
So we produce, based off the client's circumstances, a report for both the client and their advisor to look over. And at a high level, this report influences the client's decision-making in which health plan to pick, but also provides cost estimates to the advisor and premiums and potential out-of-pocket costs so that the advisor can be a better planner for these costs, because that has been a black box for advisors in the past. They've not known how to estimate on a personalized level what their clients are going to be spending on healthcare. And we believe that estimate starts with helping the client pick a health plan, understanding what health plan they're on, and then generating estimates based off of their healthcare needs. So this report that is produced, we call it the health planning analysis. It's basically a summary, typically of 3 to 5 different health plan options for the client to consider based on information that they gave us, like their doctors, their medications, their income, any health conditions. And then we also ask them a variety of preference-based questions or lifestyle questions, such as, are you comfortable getting a prior authorization for services, or would you prefer to just be able to go see whoever you want? Do you have a second home in a different state, maybe a vacation property, or do you travel often and seek care in a different state than the one that you reside in? Are there any insurance companies you really like working with or really don't like working with? Questions like that that also tailor our analysis to be very, very highly personalized and not just focused on the numbers and the healthcare needs, but also focused on just the way that the consumer, the client, likes to operate within the confines of their plan, because some of these plans can be pretty restrictive, whereas others do offer more flexibility. So we do like to try to understand that. Produce this analysis. It's delivered via a platform, can be downloaded, printed as well. And then we go through it. Our team, the advisor, the client, we can answer any questions that the client has related to their drug coverage, this out-of-pocket expense, HSAs, PPOs versus HMOs, all that sort of stuff we typically go through with the client.
And I have to tell you, that personalized interview that you do with the person that gets the report, y'all do a magnificent job of taking a very complicated subject, boiling it down into little bites that people can relate to it and can understand. So let me take just a moment. Currently, the product is priced just under $400. Could change in the future, but I just want our listeners to know that anybody who reaches out and calls the office at Provise Management Group will get a 20% discount to whatever the cost is now or in the future. And all you have to do is call 727-441-9022. That's 727-441-9022, and say, I want to use my Up Your Assets coupon to get a Caribou report. And if they'd like to see a sample of it, we'll be happy to provide that to them as well, so that they can see the value in the money that'll be spent. So let's take a moment, since so many folks find themselves as they go into retirement, and they've been in either the marketplace plan or perhaps a group plan through work, and now they've got to go into this big black box called Medicare. As we go into retirement, what are some things that people should be thinking about their health care? I mean, I have to admit that at one time I thought Medicare was free. I mean, I'm paying all those taxes as I'm working and everything else, and I thought it would be free. Well, obviously that's not the case. So talk about some of the things that I need to be thinking about as I go into retirement.
Yeah, we've heard that. I thought Medicare would be free, and then we've also heard the reverse, was that we thought Medicare would be a lot more expensive than it typically is. So hopefully you err in the latter camp, and it's a pleasant surprise. But it can be more expensive than you would have originally thought, and one reason for that might be because of your income. So one of the things that you need to know is that Medicare is going to price your premiums for Part B, as well as any surcharge added onto Part D based off your income from 2 years prior. This is called IRMAA, IRMAA. It's your basically income-related monthly adjusted amount, is what that sounds.
Oh, that's a mouthful.
Yeah.
It just means the more money you make, the more you have to pay.
Exactly. But one good thing to know is that if you're coinciding your Medicare enrollment with a retirement, or what Medicare calls or Social Security calls work stoppage, is actually a qualifying life event to appeal your IRMAA determination and potentially enter a lower bracket based off of your new income. So it's not necessarily set in stone. If you've experienced, there's maybe 5 to 10 different qualifying factors, like divorce, for example, would be another one, or being widowed, a change in marital status, then you can actually appeal your determination and potentially lower your surcharge. You have to do this in November of the year leading up to your Medicare enrollment, or if you're retiring within the year, you'd have to get it done within the year. But that is one important thing to know, that if you are retiring and going directly onto Medicare, then you want to watch out or be mindful that they're going to look 2 years back. They're not going to look at your existing income. Another important thing to mention as it relates to Medicare and the retirement timeline is that we often see people retire before 65, at which point you have a couple options available to you in terms of insurance. Two of the most common we see are COBRA, which is an extension of your existing group plan for usually anywhere between 18 months to 36 months. You have to be careful not to extend this beyond your 65th birthday, or if you're retiring past 65, you're not eligible for COBRA. Uh, Medicare does not that you're not eligible for COBRA, you could enroll in COBRA in theory, but Medicare does not view COBRA coverage as what's called credible coverage. And so they will charge you a late enrollment penalty, and you might have to go through medical underwriting if you miss your initial enrollment window past your retirement date. So that is something really, really important that you need to be mindful of if you're retiring close to or after your 65th birthday, that your COBRA doesn't extend beyond your Medicare eligibility, which is why if you're enrolled in the marketplace, they'll just automatically stop your coverage, which is kind of nice. You don't risk potentially missing your enrollment period, and then you wouldn't be exposed to any late enrollment penalties. But with COBRA, it's totally disconnected. So they're relying on you to remember to enroll in Medicare.
Oh, great.
Yeah.
Well, Simone, Christine, I want to tell everybody, again, if they would like to get a copy of the report, that they can get it through Provise Management Group, which is responsible for the Up Your Assets podcast. And all they have to do is call 727-441-9022, 727-441-9022. They'll get a 20% discount off of the price of the report. And I'd even go so far as to say that I just can't imagine that you have very many complaints from your report, because it is absolutely fantastic, and we are so excited that you had reached out a little less than a year ago to us and have thoroughly enjoyed the relationship. And so, everybody, this is Christine Simone. She is the CEO and the founder of Caribou, and it's all about health insurance. And Christine, I can't thank you enough for helping all of our listeners at Up Your Assets.
It's been an absolute pleasure, Ray. Thanks so much for having me.
All right. Well, you have a great day, and we'll talk again soon.
You too, Ray.
Thanks.